That doesn't sound very good. Good afternoon. I'd like to call to order the Hamilton County Board of County Commissioners staff meeting of September the 14th. If we could just introduce ourselves up here so the public will know who's working so hard for them in the county.
I'm Teresa Gillio. I'm helping out the audiovisual today.
Leslie Hervey, assistant to the clerk.
Jacqueline Paniato, clerk of the board.
County Commissioner Denise Driehaus.
Jeff Aludo, County Administrator.
Michael Freeman, legal counsel of the board.
Okay. Yeah, Michael's back, our legal counsel. He is a new father. We'd like to congratulate him for that. So welcome back. He's glad to be back. He gets a little bit of a rest now. So we will start with our first agenda item, which is the update of COVID-19 spread, vaccine distribution, and Commissioner Greg Kesterman.
Well, good afternoon, Commissioners. I appreciate the opportunity to brief you once again on our update with COVID in Hamilton County. So here in Hamilton County, we continue to see increased cases week after week. The numbers that I'm sharing today are higher than what they were last week. We as a county are actually getting fairly close to the 100,000 mark for total cases since the beginning of the pandemic. Currently in Hamilton County, there are 8,100 active cases of COVID-19. Our daily average right now is 345 cases of COVID we're seeing countywide, which continues to be elevated. It is slightly down from where we were just a couple days, but I think those are anomalies. I don't see any trends at this point that would make me think that we've met a peak and are heading in the other direction. So we continue to be very highly elevated. Our percent positivity for Hamilton County, I should say for the region, is 11.9%. Hamilton County is just slightly below that at 11.8%. As far as testing, which is the bottom portion of this graph, we continue to see a lot of testing. We're at 3,910 COVID tests reported each day right now. From my perspective, that's good news. And the message continues to be, if you feel sick, get tested. We know that if you stay home when you're sick, you're less likely to spread COVID-19, which is a great thing for our community. As mentioned, with our cases being a little bit stable over the last couple days, our reproductive number has dropped just slightly. Today we are at 1.02. For the region, we're at 0.99. I don't see any reason at this point to celebrate this, although any day with less cases I would say is good news. But certainly it's way too early to call this being a trend. As far as hospitalizations for Hamilton County, today we are at 528 people within our region's hospital systems, 148 people within our hospital's intensive care units, of which 115 are on ventilators. So also, once again, not a good story to tell. I know later in today's commission meeting you have Krista Hyacin from the Health Collaborative reporting, and I'm sure she'll dive in deeper on some of those numbers, but certainly very concerning. When you look at the age demographics, we continue to see those between 60 and 69 being the highest group within our hospital systems, although those between the ages of 50 and 59 and 70 and 79 also make up a large portion of our systems. Last week, Commissioner Driehaus actually asked a question about breakthrough cases, specifically why the hospitalizations for those are higher. And so I spent some time, and actually the FDA released a study a few days ago, and I think this is important to spend a moment on. The data that I've been sharing and that is nationally kind of commented on is from the beginning of January through the present. So the denominator is all cases from the beginning of the year. And so right now, it's correct to say that 3% of the cases are breakthrough in the hospital. So 97% of the people since January have not been vaccinated when they end up in the hospital. When you take a snapshot, though, if you were to walk into one of our hospital systems today or in our region over the course of a month and look at it, today that number is greater. So over the course of the month in our region, our hospital systems are about 20% breakthrough cases. So the denominator shrunk. We're looking at just those in the last month, and that helps to kind of get at your question from last week, why we're seeing more and more people in the hospital, including some breakthroughs. It's important to note, though, vaccine still works. Vaccine is incredibly effective. And in fact, the FDA, as part of that study, reiterated that the vaccine is 5% more effective for the Delta variant and 10% more effective at preventing hospitalizations and deaths. So just because I'm saying that the percentages have shifted a little bit, it's extremely important to continue to get vaccinated. Switching gears now to look at the Centers for Disease Control map of spread for the nation and zeroing in on Hamilton County. Today we are at 323 cases per day, which mirrors very similar to the number I shared earlier, and 11.84% positivity. We continue to inch up slowly with vaccinations. For those over the age of 12, we are at 65% vaccinated. In addition, 55.5% population of our total population has been vaccinated. And just like I reported last week, for those over the age of 50, here in Hamilton County, we have successfully vaccinated over 70% of those individuals, which is great news. A lot of work still to go. My team is out there every day doing our work, and we have more than 100 locations in Hamilton County, but we are making progress. My last slide touches very briefly on the changes announced by the Biden administration last week. Really, the major news pieces from this were the initiatives to get more of the population vaccinated through workplaces. In that announcement, he indicated that all federal workers would be required to get vaccinated. In addition, employers with more than 100 employees. That said, we don't have the details of that plan yet, so we don't know exactly how that will look and how that will roll out. So we will be watching that closely. Clearly, any opportunity to get a workforce vaccinated means more days on the job for their workers, which is a good thing, and it also reduces hospitalizations in our community. Other aspects of the plan are really nothing too groundbreaking. They're going to continue to assess booster shots. There's been a lot of news on whether you need one, don't need one. We really will not know until the ACIP meets in the coming weeks on September 18th. When that announcement happens, we'll have more details, but if we need to booster here in Hamilton County, we are ready to do so. Our agency is ready, as well as our providers. In addition, the Biden administration announced the desire to keep schools open. As part of that plan, it includes vaccinating teachers that are part of Medicaid programs and federally funded programming, as well as other social distancing and tools to keep masks on kids and things of that nature. The plan includes increasing testing, which, as you know, through Test and Protect and your funding, we are absolutely in a great spot here in Hamilton County and continue to have great testing resources for our community. And then lastly, the plan talks about protecting the economic recovery and improving care for those with COVID-19. Those are all the slides I have prepared, but happy to take any questions.
Thank you, Commissioner. I'll open it up for my colleagues. Vice President Reese, if you have any comments.
Thank you. Thank you, Health Commissioner Kesterman. I wanted to, if we could put the slide back up on the White House slide.
Yep.
Okay, on these federal updates, on the one where we're saying increasing testing, are any of these coming with extra funding, or they're just the mandate side of things?
So at this point, there has been no announcements on the meat of the plan, just really high-level pieces of the plan. I would anticipate that they do carve off pieces of the funding that's already available, but they don't have details on how that will happen.
Okay. And then the other issue on the protecting economic recovery, on that piece, you're saying these are just the buckets that they said they're going to focus on?
Yep, so inside of that plan, they have, or inside of that particular bucket, they have 3 items: new support for small businesses impacted by COVID-19, streamlining the Paycheck Protection Program, or the PPP, loan forgiveness process, and launching the Community Navigator program to connect small businesses to the help they need. Those are the 3 items that the Biden administration lists.
Gotcha. And looking at can we go back to the booster? Because I'm running into people who said they had a booster. And you're saying we're still evaluating booster shots?
Yep, so there's 2 types of shots. I don't actually have a slide today for it. The vaccine is all the same. Some folks who have specific immune deficiencies or other medical conditions, including transplants, are recommended to get a 3rd vaccine. So that means they self-attest that they have one of these conditions, and I believe all of the providers in Hamilton County would acknowledge that and then vaccinate them with a 3rd shot. A booster is intended for the general population to enhance your response to the vaccine itself. So at this point, no one has been officially authorized for a booster shot. Realize it's the same medicine in both of those scenarios. And so folks should, generally speaking, wait until their physician says they get a third shot because of a condition, or until the FDA approves a booster for the general population.
Okay, so their third shot would only be from their doctor? No
That's
one would be.
correct.
Okay, because
Yep.
some people were coming up to the 513 relief bus like, I want a booster. And
That's
someone
right.
else said, I got a booster, so it's just a matter of terminology.
Yep.
Gotcha. And then we also are still doing the $100 first-time shot. Do you just want to, for people watching?
Absolutely. So if you were to go today to any of Hamilton County's mobile units, whether it's the 513 relief bus or the mobile units operated by my office, you are eligible on your first vaccination to get a $100 gift card. And all you have to do is come to a clinic and get vaccinated.
Thank you.
Absolutely.
Thank you, Commissioner Dreehouse.
Thank you, Madam President. Thank you, Commissioner Kesterman, for being here as always. So we had a situation up in Lucas County, I guess it was yesterday or overnight, where the emergency room beds were full. And they were on a code red because of this. And so I got a call this morning about this and the impact that there might be to a place like Hamilton County as we continue to see individuals go to the emergency rooms for emergent situations, but also related to COVID. And some of those folks being in there because, and this is just anecdotal, I want to share it with you though, because I want to ask you a question related to it. So as kids are quarantined and not allowed to go back to school until they get a positive test, some of them, I'm told, are going to the emergency room for that test, which I think we would all agree is probably not the most appropriate place because we've got all the Test and Protect sites available for testing. And so I think the idea was, is there an opportunity, if this trend were to continue, to have tests available through the school somehow, whether it's through the superintendents or the principals or however that would roll out. But because so many of these are related to kids, could the schools have availability, or do they have availability to testing so that they can kind of streamline that process outside of any hospital that they might be inclined to go to otherwise?
So I have the privilege every Friday of briefing the public superintendents in Hamilton County. And through that relationship, when the state made their Binax Now test kits available, which are the self-administered home test kits, we were able to get, I think, several thousand, I forget the exact number, to the schools to distribute. In addition, in those weekly briefings, I have shared information about the Test and Protect opportunity for testing, as well as opportunities to request additional Binax Now test kits directly from the state. So they do have that opportunity.
And so does the state then have those available in a large quantity for the school districts that want to get those test kits?
That's correct. They still have them available. They're good through the end of the year. They have an end of the year expiration. And just for reference, I heard, and I don't know the exact numbers, but I want to say from like the beginning of the year till June, they gave away maybe 100,000. And in the last month alone, they've given away 300,000. So the demand has increased significantly.
Okay, so I was going to say that it might be helpful to just make sure that the general public is aware of that opportunity, but it sounds like they are.
Yes.
The numbers have increased that dramatically.
In addition, the Hamilton County Library System has several locations in which they're giving away Binax Now test kits that they are getting from the state of Ohio as well.
Okay,
And those locations are listed on their website. I don't know them offhand.
okay, great. And they're also, are they on Test and Protect as well?
They would not be on Test and Protect. Test
Okay.
and Protect's up to date with the vaccine, but not on the testing side as far as those other locations.
Okay, okay, great, thank you.
Yep.
Thank you. And I know the libraries, they ran out fairly quickly this weekend.
Oh, my.
Yeah, but, and maybe Krista can talk about the hospital capacity when she comes up. I just wanted to thank you once again for coming in and being consistent and comprehensive as it relates to the report for the board and also for the public. So I thank you so much for that.
Absolutely. Happy to help.
Thank you. Our next item on the agenda is hospital is at capacity, and Krista Heisen is here to speak to us.
Good Good afternoon, everybody.
Good afternoon.
My name is Krista Heisen. I'm the Assistant Director for Emergency Response and Public Information Officer for the Health Collaborative. So I work with all the hospitals. And I added a couple slides. Oh, thanks. And just to add one point to your question, Commissioner Dreehouse, due to the number of test kits and just overall demand for the rapid tests, we did add a link which goes directly to the Cincinnati-Hamilton County website for the library, and it lists out which locations, which are the library locations with drive-throughs, and that's where individuals can get the tests.
Great, that's great, yeah.
So just brief background, if you are not familiar with the Health Collaborative, the easiest way to explain it is kind of like the Chamber of Commerce of Healthcare. So those are all the partners I work with. And then my job specifically is running with a fabulous team, the Disaster Preparedness Coalition. So just because we are located in a tri-state area, we make sure to include Southeast Indiana and Northern Kentucky in all our plans, because we know, just like when we see, if Southeast Indiana hospitals are getting filled, then we see something like a Mercy West getting a lot more patients and then going down, kind of imagine it going down 50 East, and our hospitals continue to get crowded. So with this coalition, I work with a lot of partners, whether it is local governments, health departments, hospitals, police, fire, EMS, to make sure we are all aligned and we all have a plan in order to respond to whatever may come up, and things like pandemics. So just a brief overview to provide. So specifically, under the grant that I work on, I am responsible for what is called Region 6, which is the 8 southwest counties in the state of Ohio. And due to Governor DeWine's planning for COVID, he assigned us zones. So that joins Greater Dayton and then Greater Cincinnati regions. So we are easier to share resources. It kind of cuts a little bit of the red tape when it comes to supplies, whether it be gloves or gowns or masks, N95s, et cetera. So we make sure we work together with our neighbors to make sure that every patient and individual that gets seen in our hospitals has what they need. And then just a brief overview of the chain of command. So we also work with the Ohio Hospital Association, and then with those zones, our zone lead is Dr. Rick Lofgren, who is also the CEO of UC Health. And then through that, we run what is called the MAC, or the Multi-Agency Coalition. And then through that MAC, we have what is called the Hospital Steering Committees, the Public Health Steering Committees, and the Congregate Care Steering Committees. Because in the beginning of the pandemic, those were our 3 areas that were getting pretty hard. And just to define congregate care, meaning anything like long-term care, nursing homes, things like that. So we also work on projects like establishing alternate care sites. We were asked to do that by the governor's office last year. Luckily, we did not have to use it, but just an example of some of the community collaboration and things that we've worked on. An alternate care site was then magically turned into a mass vaccine site. So I will tell you, that one was a lot more fun to work than the other one. So one of the things I wanted to help clarify and answer any questions on is called EMTALA. So EMTALA is the Emergency Medical Treatment and Labor Act. So basically, if you are a critical care hospital, you have to see any patient that walks in your door and needs care. However, we're seeing some quite significant wait times in our EDs. And one way you can help us is kind of what Commissioner Dreehouse mentioned before, is really truly utilizing and helping us promote using the right level of care. So if you do need a COVID test, there's so many free resources, and not just, take for example, if the library is out of test kits, which can happen due to the high demand, there are other PCR labs that are available through either Test and Protect, through HealthSource Ohio. There's multiple locations also within Hamilton County. and then other organizations such as urgent cares, federally qualified health centers, places like that. So there's really no need, unless you truly have either difficulty breathing or a sudden cardiac event or something that is truly an emergency, there's really no reason to go to the emergency room if you just need a COVID test, especially if you're asymptomatic. I wouldn't want to go into an ED, especially with what we've been hearing with families coming in and kind of clogging up the ED. And if you're there for immediate care, absolutely, we will get you in. But the important thing is to know it might be a little bit of a wait. So I wanted to go over regional capacity. So the top two graphics are also available on the website cctst.org/COVID-19, or if you just Google CCTST COVID, it's the first thing that pops up. And what that means is we just give an overall capacity of what our hospitals are looking like at a given time. So we really look at that to monitor the amount of stress and strain on staffing. So that bottom chart that you see is just a snapshot of what we have called our surge escalation and triggers. So with more patients, it creates a more complicated care plan. And then the more patients you have, the quota of provider per patient kind of goes up. So the important thing to realize is way back when we were talking in March of 2020, the number one thing we don't want to happen is to overwhelm our healthcare facilities. And unfortunately, if we flood EDs with things that are truly not emergencies, that is what happens. So, and with CARES funding through Hamilton County, this is one of the things that has been incredibly helpful for us to do things like test and protect. And with Test and Protect, and the website is testandprotectcincy.com, which is really great because it has both testing information and vaccine information. And then there's a few resources, and I'm happy to take questions.
Okay, thank you so much for the information. I know we keep talking about the free test kits, and as we know, when there's a demand for something, other entities try to make a profit. And so I called all weekend for free tests, and some other people I know went for those, but the pharmacies are charging, they charge your insurance, and you can take your receipt and send it back in and get, one place was $150, which did not get paid. But who should the public go to if there's a concern about something that's supposed to be free and it's not? Would we let Hamilton County know? Would we let the governor know? I mean, at what point? Because free is not free anymore, I've found out this, especially this weekend. So they have the opportunity to charge if you have insurance. But my concern is they're getting these kits for free, but they're charging the public. So where would the concern or complaint go to?
I can speak to the vaccines. I know the vaccines can charge an administrative fee if the individual does have insurance, but the vaccine itself cannot be charged. That is completely free.
Yeah,
And
these
then-
are for the testing
And then
kits.
as for the test kits, if you are a resident or you work in Hamilton County, Test and Protect is absolutely free. And then everything through the libraries is free. I haven't received that.
Now, I haven't heard that the library
Okay.
was trying to charge or
Okay.
anything, but other places are definitely charging. So, Commissioner, what would you suggest where they should let people know?
There are actually certainly private pharmacies and like small clinic-type settings, which they are allowed to charge, and they do charge. So I would just steer people away from those because we have such great resources here in Hamilton County, the Test and Protect and the libraries. We actually, on my mobile clinics this week, started carrying some of those
No, you
Binax
told
Now
me that.
test kits. So we're trying to make them more available as the demand has gone up.
Okay, thank you. Commissioner, Vice President Reese, you have any questions or concerns?
Yeah, I just wanted to follow up on that. I like, Commissioner, that they're going to be with the mobile. I was just going to suggest that maybe they need to be with all the mobile units. So as we got people coming out that, especially now, people say they need to get tested again. But I do want to follow up, President Dumas has a good point, because when the Vice President, Kamala Harris, came in and had a meet and greet, they didn't, even if you were vaccinated, we had to get a test, and they gave us like less than 24 hours to do it. So sometimes, and that's really good for us when we get a chance to have to do these things, because we then see whatever we're promoting. I mean, a lot of times we do a PowerPoint, it's like, oh, it's just here and it's so easy. But then when you kind of get out there in the streets and you have to look for it, number one, timing. I don't know if our sites are 24 hours. People working third shift, second shift. I don't know, where they would find a test. They said go to Walgreens, and I will tell you, someone, I went to 5 Walgreens, and I finally called Commissioner Kester. I should have called him earlier. And they had the cheaper version. Of course, we're out of it, not available. But we have this other version, and the other one required us to get on a computer and log in. I mean, we got people don't have computers. We're trying to get communities with Wi-Fi. We just got some communities to have free Wi-Fi, and we're trying to expand that. So sometimes it's not as simple. Now, if you don't have a job and you ain't got nothing to do, we got Test to Protect that's available in these hours. But if you got a job, you take care of family, you got kids in school, you get this symptom at nighttime, what's available for them? So I just want to kind of put some of those things out there, some of those scenarios, and maybe there's things that, because of those scenarios, some things that we could add. I don't know what those are, but as we hear these situations, we may look at, say, okay, well, to our administrator, Jeff, is there something else with these CARES Act dollars or ARA money, or Commissioner Kesterman, is there something, like you said, you're with mobile units now, all mobile units now should have them, I think. But those are some of the things when you kind of get out here in the weeds. Data is one thing, but when you're out here in it, it's a completely different thing. And so when President Dumas asked the question, you're like, well, I know about vaccines. I can't tell you about the tests right now. Those are the kinds of things that people are really dealing with. And we're back to testing now because that Delta has come in, and now people are saying, I gotta get a test. So one reason they may be going to the hospital is because they get a symptom and it might be at nighttime. And we've already told people to be very alert, maybe, and a little bit of fear. So they're like, I got to get to the hospital, because I can't get a hold of a test. And the only thing's open is the hospital. So maybe we should look at, or if you have data or something, we should look at urgent cares and, what's their supply level? What can we do? The library is closed at nighttime. What can we do to make it accessible at night, and maybe have it on our website a little bit better? Between these hours, there's some other after-hour places that may contain it. I don't have the answer to that, but I just think that is an important component. And these tests are costing, and there are a lot of people who don't maybe have the best insurance. And the other piece of data that I would like to get is, what is the hospital bills on these folks? I'd like to know, because we may be sending people into bankruptcy. I mean, you go in there with COVID and you beat COVID, but when you get out of there, 5 days at the hospital, you're talking a whole lot of money. So we want to see that as well when we look at all of the factors, the economic, the health factor. I'd like to know how much are people walking out, what type of bills are they walking out with on this COVID care. So that's all. Thank you.
Thank you. Commissioner Dreehouse.
Thank you, Madam President. Thank you, Krista. So I was going to follow up on this idea about because there's a distinction between test and protect and going to get tested as opposed to going to get a test kit. And so we're kind of drawing that distinction here, as Commissioners Reese and Dumas suggested. And so I do wonder, too, that, if someone is going to test and protect, because that's well publicized, there's a pretty direct link to get to that on the websites, does it make sense to have them carrying the test kits so that what if there were someone coming in and getting tested and they had a family member that couldn't make it in, could they walk out of there with a test kit so that that person could take the test at home?
Potentially, that's something we could absolutely explore. And especially, I think there are the rapids on the 513 relief bus as well.
Okay, so are they available at the Test and Protect sites?
I'm not sure, I'll have
Can
to
you,
confirm.
can you
Okay.
put that microphone, yeah, okay.
I'll have to confirm that for you.
Okay, yeah, so as we think through this and making those test kits available, absolutely on the mobile units, but also, of course, at the brick and mortar units where people are going, as well as the schools, because so many of the folks getting tested right now are kids, so they get back in the classroom. And that's just going to keep happening. You know, that's going to compound and compound and compound. So, yeah, I'm glad you're here to think through this. I think we're all trying to think through how we make this as accessible as possible, not only by way of, you know, access and the hours and the places, but also they're free. And so the more we can get those into the hands of folks, the better off we're going to be. So, yeah, I'll be interested to know how that goes and as we continue to think through this stuff and and ultimately keep people out of the hospital, because that's what we're all trying to do.
And I also think it's really important to know that depending on whether it's an internal school rule, school district rule, some won't accept rapid test results. They have to be PCR lab confirmed results. So that's a little bit different too. So rapids are really, you know, if you are traveling and you just want to make sure you're okay before or after travel, but rapids are not lab confirmed. So some, whether it's a concert venue or a school district, they may want that PCR lab confirmed test result as well.
Can I ask just to follow up on that? So, yeah, there are different kinds of rapid or tests, home test kits. I have taken one, Commissioner Reese may have also taken the same, where you have to get online and have your test result verified. Is that considered one of the just rapid ones that so you can go now and do something, or is that not?
I think it depends on the venue and
Okay.
institution. So I've seen it different ways just across the nation. So I think for the most part, people want lab confirmed. Because I do know some telehealth appointments, you will either do it and the nurse tells you, okay, twist, twist,
Right,
twist,
right.
in a certain number of time. But we know that, you know, to human is to err, unfortunately, and that can present some issues. So that's why it is best to have that PCR lab confirmed test.
So by lab confirmed, you mean you have to go in and get a test as opposed to administering it yourself?
Correct.
Gotcha. Okay, thank you.
And is that the same for Hamilton County test that you just got, Commissioner?
They are they require the telemed.
Okay,
Madam President.
okay, sure.
Just want to, this is really good, because I could imagine people at home being very confused.
Yeah.
Do we have a 24-hour location?
Not to my knowledge at this time.
Okay. Is there possible for us, I know a lot of times we were trying to not have people go to the hospital, not for COVID, but for other medical stuff. Is there any partnership opportunities with urgent cares that we could do that would do a lab test that would be open, say, a longer time? Because a lot of times in the hospital, and I'm not a hospital expert, thank God, but when I've had to go to the emergency, it's packed at nighttime. I mean, nighttime is when it gets really big. So I didn't know if there might be an opportunity. There's a nurse that owns urgent care on the west side. And I know we had partnered her with the Ohio Department of Health, but she wants to get more involved, but there may be others. I was just saying if there were a couple, if we had an east, west, north, and south location that stayed open, you know, in the evening hours, nighttime, that we could maybe partner with a test and protect hybrid. We may have that already, but if not, maybe you might want to look into that, because testing is going to go way up, because now employers are saying you got to get tested. And then my last piece is the city of Cincinnati their employees have to get either tested every day or they have to get the shot. Are we doing anything? I know you're working with the commissioner, health commissioner there, but is there things that we could do to help with that? I know this weekend we were in Forest Park, the 513 relief bus, and we ended up vaccinating the Popeyes chicken employees. Once they kind of found out we were out there, said, oh, we need to get vaccinated, and they came. So is there something that we have with that, and if there's a way to also have some type of test to protect at least a couple locations that are open a little later?
Yeah, I can bring that to my leadership to potentially explore, because we have those relationships where we've done Saturday and Sunday clinics or after hours, or we also have what is called a strike team. So back when testing was really highly in demand and we would hear of certain outbreaks, whether it would be from an employer or a healthcare setting, whatever it may be, we would send in a direct strike team to do on-the-site testing. And a lot of times that was after hours as well. So I know we can kind of explore those different options.
A couple real quick clarifications. There are several urgent cares around the area that do provide testing. They are at cost though, meaning they will charge. So there's, from that perspective, I don't think they're as free, but if you need a test in the middle of the night, there are opportunities. Many of them do take insurance, which I know is not great for everyone. The other item I wanted to make sure to point out, or I guess two items, you asked about the city of Cincinnati. They are actually acquiring test kits from ODH, the Binax Now test kits, and providing those to employees to assist with their rollout of their vaccine or test requirement. And then the last item that I'll point out is, while the Binax Now test kits require or have the telemedicine need or opportunity, that gives you a definitive medical result, meaning at the end of that test, I have in my email box a result that I can show my employer. That test kit can be used and it has directions for use without that telemedicine appointment. So if you're concerned in the middle of the night, you can't get a hold of them, you can use that test kit to get an instant result. It takes 15 minutes without a telemedicine, and it is possible to do. Those kits can be acquired before you have COVID or before you have symptoms. So if you're concerned about it, I would recommend folks do take advantage of these locations like the library, like our mobile clinics, and get a kit and keep a kit at home so that in the middle of the night, you're not driving your 7-year-old out to get tested. You have that access so you can figure it out and then make decisions based on that result.
Yeah, thanks for that additional information. And Krista, I wanted to thank you so much for the Health Collaborative and the things that you're doing and the partnerships that you've established in the county. Okay, thank you. So we will move forward. Next item on our agenda is MSD 2021 Capital Improvement Plan progress. Diana Christie. Hi, Diana.
Hello, good afternoon, Commissioners. We're here today to give you an update on our capital improvement program for 2021. So we're going to talk through a brief status update just on where we're at with all of the projects that the board approved for this year in various stages. And we're also going to give you a little bit about some of the challenges we've faced, as we always do, in implementing the program, and then what we're doing to address those this year. So I have here today Todd Papes, who you've met before. He's our program manager. He's with Stantec, but Todd works directly with our engineering team, and they've been, working very closely with us to improve our capital program and really just implement some new reporting and other structures. So Todd's going to give the presentation, and we're both here for questions at the end.
Thank you.
Just a few slides. I think you just advance it that way.
Thanks, Diana. Good afternoon, Commissioners.
Good afternoon.
Appreciate the opportunity today to give you an update. I'll jump right into the slides. I guess just as a refresh on where we were with the MSD's 2021 CIP, it was about $123 million. Consisted of a number of planning and design projects, about 31 of them. There were 18 construction legislations envisioned, and as normal, there's about 14 different allowances that are also included as part of that MSD. There's some of these little raindrop charts, if you will, that give you a little bit more of a granular view of the breakup, or breakdown, I should say, of the CIP. Gives you an idea of where you stand from kind of a WIP and an asset management versus another category. If you're looking at kind of the project-specific phasing, Gives you a little bit of where you are from a planning versus design versus kind of construction, to give you kind of the life cycle overview, and then where you stand from kind of a WIP asset management dollar perspective against allowances and contingencies overall. So that's just kind of a starting point on what was actually got approved last December. I think it's good just as a reminder of kind of, some of the key parameters around MSD's annual CIP. It is an annual process. MSD puts together their recommendation that normally gets adopted in December, and that is approved for the upcoming calendar year. With the adoption of the CIP, that does approve the progression of what we call the planning and design projects to move forward into the procurement and contract negotiation phase, and ultimately the execution of a contract for procurement of those services. The construction projects, however, do require a separate legislation to be prepared and submitted to the board for approval. And I guess just as a reminder overall, as we look at how we manage the overall CIP, all these projects have a certain life cycle to them. So while we do introduce new projects every year, there's always the continuation of projects that were approved in prior years. And to just give you a sense of kind of what that life cycle looks like, your typical project probably has a 1 to 2 year planning horizon to get through that planning phase, including the procurement of the consulting services for that. That's about the same for the design. And some projects also require some right-of-way or easements, depending on where we're doing that work in public space. That process could be as quick as a year. It could be 3 years or more, depending on how complicated that right-of-way activity may turn into. And then on the construction side, depending on the size of the project, construction can be anywhere from a year or multi-year for some of the larger projects. So I just wanted to put that out there just as a reminder of kind of how things are always moving through kind of a continuous 12-month cycle as new projects come in, older projects are kind of getting finished. So in terms of progress in 2021, there's been a number of planning and design encumbrances that have been completed up through August. On the planning side, 5 contracts have been successfully awarded, negotiated, and contracted for, and then notice to proceed issued. And on the design side, 11 have been completed. The forecast through December, based on our current scheduling system, would indicate that there will be 14 total planning projects and 22 design projects awarded a notice to proceed by the end of this calendar year. On the construction contract advertisement milestone, we've had 6 projects that have received advertisement for bids, and at the end of the year we're anticipating another 6 for a total of 12 projects to be advertised for construction. And just to give you a sense of kind of where we are in the overall life cycle, so starting with planning, going through design, into construction, substantial completion is kind of the other big milestone that we kind of track, which is really kind of the completion of construction. To date, we've done about 5 of those projects and issued a certificate of substantial completion, and there'll be another 8 of those going through for the rest of the year, so we'll have 13 total projects. I guess of note, the biggest one will be happening this month, which is the Lick Run Greenway project. So that $105 million project will actually achieve its contractual substantial completion this month. Just kind of a quick snapshot on where we are from the allowances and contingency standpoint. So these aren't really project specific. These are allowances that are allocated into the CIP every year. Some of these are for planning, some are for design, some are for construction. This is kind of where we're at from a total encumbrance standpoint through August. So we're about 75% encumbered to date. We don't necessarily forecast this out, but I envision that most of this will be encumbered by the end of the calendar year. From a cash flow perspective, right now we are forecasting to spend about 80% of the budget. That is pretty consistent with the historical performance in years past. This really is kind of, it builds into that whole kind of rolling cycle of projects. So some of this would be cash flow from projects that could have actually been authorized for planning 4, 5, 6, 7 years ago even. They're just kind of working their way through the system. So as you'd expect, not all those things go exactly as planned. So trying to match the cash flow exactly probably isn't realistic, but hitting an 80% target is certainly reasonable. And as Diana said, there is a plan put together every year. There's some expectations on how projects will proceed, and that's built into the scheduling system, but not everything always goes according to plan. There have been some challenges in the past years. One of the challenges that we deal with, it's really just kind of an outcome of how the CIP is put together, but with the adoption of a 1-year CIP, that authorizes the planning and design projects. It really creates a cycle where the first half of the year is really spent putting out RFQs, going through the procurement selection process, negotiating and scoping those projects, and then executing a contract to get the NTP out. So typically, first half of the year is kind of a procurement phase, and the second half is kind of an execution and get started on those. And then with the adoption of the next year's book, we start that cycle all over again. So instead of having kind of a smooth 12-month process of always doing a little bit of both, we kind of have a 6-month of doing a lot of procurement and then trying to do a lot of delivery and then switching gears again at the beginning of the next year. Probably worthy of note, there has been some departures of some senior staff within MSD. Given the current job climate, it has been difficult to fill some of those roles, so they've had a lot of key positions that have left either due to retirement mostly, some resignation, but backfilling those has been a challenge, so there has been some resource limitations within the organization. There's also some things that occur, kind of project specific. So there are a number of planning projects that are envisioned to be initiated in the course of a year that when checked back with the modeling group, it's determined that we need additional flow monitoring data to calibrate the models. That money is contained in the allowances. Unfortunately, to put those meters in, we do need 12 months of seasonal data before we can bring that data back in and recalibrate the model to ensure that we've got a good basis for design to complete that planning effort. When that does occur, that usually does add a year of delay into the execution of the NTP for the planning project, which then obviously cascades to the rest of the project, impacting the other downstream milestones. When we do get the planning efforts done, we've had some instances where the consultants who are performing the planning services have been late in delivering the business case evaluations. Same kind of thing happens with that. With any month of delay that occurs within the planning final milestone, that cascades again into the start of the design and then authorization of the construction. So the whole schedule just kind of keeps moving. So those are things that have been happening. Some of that has been due to some COVID impacts. Honestly, people have had some resourcing issues, so some of the schedules have slipped a little bit. And probably the other biggest one that occurs that really impacts getting the construction legislation and construction advertising going is right away. Schedules are put together on kind of a standard template approach. We try to tailor them as best we can to what we know about a project early on, but as you get further into the design and you have a better understanding of what the alignment requirements are going to be, the right-of-way issues are much more evident, and in some cases they are challenging, and those have caused delays to a number of projects. So a little bit about what we're trying to do to improve some of that. So MSD's embarked over the last 2 years on really kind of implementing a number of systems built around driving some consistency, some transparency, and some predictability into the delivery of the CIP. One of the most important things that we did was put together a project delivery system. That's really the means by which it dictates kind of the governance of how a project moves through its project life cycle. It is kind of an interactive system built in a SharePoint environment, and it's really kind of the how-to on delivering a project. So if you're a project manager and you are in the design phase and you're at an activity of 90% submittal, you could go into that project delivery system and it will walk you through, here's all your procedures, here's your templates, here's your forms, and there's workflows that kind of guide you on how to go through that process. So it's a good tool for doing not just orientation and training, but also ensuring that for every project manager you have, they're always doing something the same way. So irrespective of the people, the process remains the same. We've also implemented a software package called eBuilder, which is the project management platform that now all projects will be managed in. We've been working actively to migrate older projects and new projects into that system. That's been going through in a number of waves. The 5th wave of projects will be completed in the next 2 months, and we will have about 120 projects now in eBuilder that will capture all of the monthly update project-specific information. It allows the consultants and contractors to upload all their documentation directly into the system, and it's built with kind of coded workflows so that everybody has to do things exactly the same way, and allows us complete visibility into where we are on any stage, who it's with, and how long it's been with them. So we can get some visibility into if we're experiencing a delay or there's an issue on a project, where it is and how long it's been there. That actually then gets into this kind of monthly project review. That's a practice we instituted about 2 years ago, where every project every month is gone through an update review with the project managers. We go through kind of budget and schedule, and use that as a means to really update and forecast where we think we're going to be so that those budget schedules can be reflected. We then can measure that forecast against the baseline we started with, and then have variance reports that start identifying where we're experiencing some projects with minor issues, or maybe some projects that have some major issues that may need some management attention put to them. Where we do need that attention, we have formalized that escalation process. So instead of trusting on hallway conversations or an email, that is now a workflow built into eBuilder. So those primary issues then can get routed to the appropriate person for resolution, whether that be the principal engineer in engineering, the deputy director, or the director. That's now been set up in the system and it's been successfully used for the last couple of months. And probably the other big thing we're looking at is really trying to put together a long-term planning horizon that would guide the development of the CIP book. So in the past, I think the focus has really been around, it's a 5-year CIP, but the focus is really just on that first year. And then as subsequent years kind of move in, a lot of change occurs on those. We're trying to put together, an outlook that would say, let's lay out what the priorities and projects need to be over the next 10 years. Have those with some certainty so that when you put a 5-year CIP together, those outlier years should be pretty reflective of what is actually going to bring forward and get approved in the upcoming year. Right now, that's not necessarily the case. If we can get to the point where we've got some reliability and some realistic expectations on those, it may allow for a little bit of advanced work on projects you think may be coming into planning 2 years from now, as opposed to waiting to see if they're actually going to happen or not in the year they're occurring. So it's a little bit of a philosophical shift, but it would allow for a lot more efficiency in not only how we develop the book, but then how we actually execute the projects that get approved with it. And then lastly, it's really just trying to deal with the overall issues we have with right-of-way. We've done a lot of work just kind of dissecting how that process occurs today. We've identified a number of places where we think we can shave some time off, increase some of the participation between the right-of-way teams and the engineering teams and the consultant teams, so we can avoid some of the challenges we've had where just kind of handoffs are occurring and they're not always as clean as we would like them to be. And we're building some of these milestones related to right-of-way into the project schedule, so we're not having to default to something goes into right-of-way, then we just have to wait till it comes out. At this point, we can start measuring kind of on intermediate points, are we progressing to the next point of where we need to? And if it's not happening, at least then we can flag it as an escalation issue and have a discussion about it. That was it, unless there's any questions.
Thank you so much. Just a couple questions. I heard you say 120 projects. How many projects right now does MSD have going on in the county?
In terms of projects that we call open and active, it'll be about those 120. We've got another wave of probably 30 projects that we'll bring in, but those are projects that have substantially completed construction. We're going to bring them in as part of the final closeout, just to capture the data, so that we have completeness in the data warehouse for purposes of reporting. But on any given time, it's 100 to 120 projects.
Okay. And so we have a 1-year CIP approval process, and I'm just wondering, so we have these 120 projects out there, so every year we will approve or not approve another project. And I guess philosophically, I'm asking, why do we continue to have so many projects going on before we finish other ones? I'm just asking. I know they're in different areas, there are different needs and all of that, but so here we have this 1-year approval process. Has this always been in place, or was it like a 5-year approval? I'd like to know, because I haven't been here that long, but Diana, has it always been a 1-year approval process?
Yes, since MSD has existed as in its current state in 1968, the CIP process is defined that we present a 5-year planning budget.
Sure.
So we provide a capital improvement program for the 5 years, but the board is only approving and appropriating funds for the 1 year. That is how it has been.
So we could possibly say, and I'm not suggesting this, that we complete the projects that are already in existence and not move forward on any new ones. And that's a possibility, we could say.
The challenge with doing that is, as I indicated earlier, most of the, if not all the projects have a pretty long duration related to the entire life cycle. So if you assume your average project's got a 5 to 7 year cycle on it, I think it's a little challenging. So the way you've got it set up is pretty typical of any other place that I've worked. Every year you're going to have some combination of planning, design, and construction. Right now, you're doing that at, probably it's like 5 to 10% planning, 15 to 20% on the design, and 75% of construction, which is appropriate. That kind of achieves kind of industry benchmarks. And you're on just kind of a rolling cycle. Every year there's new planning, new design, new construction, and then you will be finishing up some of the construction from years previous. And then with each year, some are dropping off, new ones are coming in. But you've got a constant slate of projects going through. It's easier to manage, it's more efficient, and it's actually better for your consultant community and your contractor community, because you're putting work out on kind of a consistent basis, and you don't kind of anticipate what you're doing, you'll get better pricing on doing that. But if you kind of have the start and stop approach, that is not really conducive to getting the best price for the work, to be honest with you.
So every year we're starting new projects, so, okay. I'll ask my other question. I read in here that 75% of the allowances and contingency right now is where we are. So are you anticipating the need, I mean, this is, we're going into October, do you anticipate the need to come forth for additional funding to meet the contingency need, or do you think we'll do fine by the end of the year? They're both looking at each
It
other.
can be a little bit difficult to forecast. At this point, I don't foresee a need to come back to the board for additional funds on any of the allowance line items. I think we're going to be okay from a contingency standpoint, and the other allowance items are really already mostly encumbered or working to be fully encumbered, so we'll be okay, barring something unforeseen condition.
So could you just say, how far out are, the next project to be completed started, what, like 5 years ago?
It depends on the projects. I mean,
Well, I'm just asking, I mean, you have an idea of what's the next project we're going to complete, do you or not? Not you, but do you know?
I mean, every project is tracked through with a baseline budget and a cost accounting system and a schedule that's put together in a scheduling software system called
Sure.
Vera P6. So, yeah, every month we produce a report. We would list out kind of what we're forecasting, so we would know on any project what the next milestone coming up in the next month would be. And if that milestone happened to be substantial completion or final completion, we would know, which projects are going to be done that month as well.
So what do you anticipate the next project or projects that will be done, do you know, according to your data?
Well, like the next big one will be, the Lick Run Greenway will be completed this month.
The Lick Run, and then what?
I don't have this project-specific list with me. Like I said, there's 120 projects on that list, all in different.
Well, I would think that you would look and say, okay, we'll be done with Lick Run, and the next one is this one. Maybe that's not your role, but I was just wondering, as we look at all these projects all over, what would be the next one you would anticipate getting done as we look at adding more projects on possibly? So I'll open it up to my colleagues. Vice President Reese, do you have any comments?
Thank you. Can we go back to the slide on challenges? And I think this is where the delay issue comes in. Because of unforeseen issues with COVID, you have on here senior level resources retire, resign over the past several years without replacements. You also talk about the consulting components. There's delays regarding that. So we have these challenges, and I guess the question is, how do these challenges impact our timetable? Does it, if I understand you correctly, the timetable, because of the delays, some of the projects didn't get finished or didn't get moving on our original timetable, is that correct?
Correct.
Okay, so with that being said, we're on a different timetable, and I see on here it says the cycle for awarding the contracts is dictated by the current one-year CIP. So as we're getting ready for our 1 year, this will be my first budget. So if I'm seeing something that says, okay, hypothetically, we had 25 projects, COVID hit, retirement, people retired, we got less people that can be out here. Things didn't go on as scheduled, so we have a delay on 25 projects. Now we got a group out here with, say, 15 new projects, But these 25, because of unforeseen situations, COVID, et cetera, we're not moving those. Those kind of either move slower or was at a standstill. So I guess the question is, as we get to the next phase, and I'm going to the next part, is 15 coming in when we already got 25 that kind of was at a stop? Or are we saying that this budget, let's get these 25 back on track as people are coming back to work, where people are coming back in, and then the 15 may come in 23 instead of 22? I guess that's what I'm trying to understand as I'm looking at a budget that I'm going to have to
So
vote on.
I guess I would offer this. When you adopt the budget every year, there's a certain amount of money there that we can work to encumber the contract with. So once we've encumbered it and we've certified funding for it, then it's a matter of progressing it to the schedule. Every project has a schedule. When we have some of those challenges that you just laid out, what ultimately happens is different projects get affected differently. So you might have a delay in getting, let's say you had 25 projects that were going to be planning and design projects. Maybe 3 of them, we don't get the RFQ put together according to the schedule, and they may be 2 months late getting advertised and then a consultant selected. The other ones might be okay. Some of those may actually get awarded to a consultant, and the consultant may experience some issues due to COVID, and maybe they're a month late in getting a deliverable done. That's going to delay the rest of that project by at least that month. So while all projects may experience some delay, some probably experience just a small amount of delay. Some might have more significant delay. But once the funds are actually encumbered, they're contracted, and it's just a matter of kind of moving those through. So we're not backlogging anything. Everything continues to move through, and we adjust and kind of monitor the schedules as they go. We can always take a look at, where do we think this schedule was going to look like when we started the project, and then 3 years later go, where are we actually at, and what are we forecasting to complete, and we can measure that variance. And, that is a useful tool to kind of understand where we're having some issues and what the root cause of those are. But you always have different projects in different phases. So, if we're having an issue with, internal resources, that may stall getting all the contracts advertised out with an RFQ and doing the selection committees and then actually awarding and negotiating the contracts. The consultants may impact finishing up the designs or the planning effort, and then you're talking about contractors on actually the construction side. So it's a whole different group of people that are all kind of working together to get all these projects through these 3 different phases.
Okay. The reason I said that I'm not a contractor, but just in my simple math, a capacity issue. For example, we got a lumber problem, right? And then, for example, if you've got hypothetically 10 contractors that can do this work, they've been encumbered, ready to go. It slowed down. Now they have to finish these projects, but now here we come with 15 more contract opportunities for these same 10 contractors. So I guess I'm just, 2 things is, one, I want to be able to report out to these areas, people that live in these areas, what's the timeline, so I can be intelligent. If I go into one of these areas, they say, I thought you were getting this fixed, or I thought that was happening. We could say, no, that's got moved back. It won't be April of next year. It'll be May of next year, hypothetically. Or that's moved back. That won't be to 2023. But we got a capacity problem because you got these folks are saying, listen, we're moving just like building homes. It's a capacity problem. People can't hardly get a home built because I got all this demand and we're moving as quick as we can. Plus we got COVID. Some people are out. So we just want to see what would that affect. My goal is not to just have encumbered funds sitting around. My goal is I want action. I want to be able to say this was completed. We are at a ribbon cutting. We done finished this. We done finished. It doesn't do us good as a board to go out. Well, we encumbered you. You sitting over there. I got $2 million sitting over there for you, but they can't get to you to 2024. So we just want to have an intelligent answer. My last question, though, is since the city manages MSD and the city does have a minority business program, I would like to see a report on what those numbers are. Now, I know the county, we don't have one, and you're going to try to join us, but you are employed management-wise by the city who has one. So wanted to just see do we have numbers, and you probably do. I'm new, I'd like to see them, what those numbers look like on these projects and other projects, but today we're talking about these. What are those numbers in terms of inclusion?
If I could, yes, just wanted to respond to that because you're correct, the city does have a minority program. The MSD's procurement, while it's managed by the city, we do not follow the city's minority program. We have our own small business enterprise program that we have guidelines for that has been approved by the county years ago. And now that we're going through the process with the county, we can hopefully adopt something. But there was a court decision actually several years ago that said that that MSD contracting cannot follow the city's procurement rules for minority business owners. So there's more background to that, but the most important thing is we do have statistics on all of our projects, on our small business enterprise, and our goals that are set and how we're doing on those. And we have a report out on that, I think quarterly, that I'd be happy to share, the most recent one, and I can just send that over later today, and you can take a look and see where we've been at. So,
Thank you. I guess
Okay.
this is another, and I'm just going to put it out there. It's just strange to me that, we could look at the court case or what have you, but again, this is another situation of taxation without participation. Minority businesses are the only group in town that have to be certified to get a contract, but don't have to be certified to pay taxes. And be charged for MSD services and those kind of things. So I just think that's kind of odd that you don't fall under the city when it's time to be inclusive, but then you fall under us when you're not inclusive. You fall under them when we're ready to get the bills paid. We can't reduce the bills on people. We can't get this, we're trying to get stuff on the water bills. We got the check in, but then when it's time to, it's like when it's time to, we own something that we don't have no control over. And so, yes, I will tell you that now because I wouldn't be in a rush to encumber anything. I hope that we could get this disparity study moving fast so that when we do encumber, we can have people be able to participate. The only time where minority businesses are equal when it's time to pay taxes. All of a sudden, you don't have to prove that you're minority. You don't have to get certified. You can pay the taxes, but you're not allowed to participate. So anyway, that is something that I guess I would like to see the court case on that. And Madam President, I wouldn't be rushing to encumber things for things that are down the road without any real timetable. But I know that we're not here for that today, but that just helps me as we're starting to be asked about our budget priorities and how we're going to do a budget and those kind of things. I want to keep that in mind. And it would help me to have a timetable, the new timetable, based on those delays, so that if I'm asked by anyone, I'm able to intelligently speak to, well, we had some delays, it'll probably be this time and not what we originally thought. So, thank you.
Sure.
Thank you.
If I could, there's
Sure.
one thing you asked previously, or President Tumash, you may have asked, but in terms of where our what project would be next. So I was able to quickly ask our Chief Engineer Ryan what is next on the list for completion for construction, and that would be our SSO 700 disinfection, which is a facility where we have our largest sanitary sewer overflow, SSO 700, and a very important project. So we'd be happy to, give you maybe a summary report on that. And I think just overall, when it comes to, wanting to have that information, if you're out in a community and they ask the status of a project, certainly the more you can, ask us in advance, if there is a project in a neighborhood, it's very difficult. I would think it would be difficult for you all to know and keep track, given the number of projects we have in the various stages. But we're always, happy to provide that in advance, or, direct you to where on our website you can find the updates, the project-specific updates, so that we would track that and we'd be able to say where it's at in the process. So it's hard to share that here for all the projects in which stages they're at. But if we know the area you're in question, we can give that in real time. So,
Madam President, I just want to make sure I understand clarity. So how many projects do we have? Is it 100? Is it 25? Hypothetical, what is, not hypothetically, but rounded up. Is it 25 projects, 100 projects? 120. So I would like to see a spreadsheet. You said you had delays. I'd like to you said we've got delays. I'm just looking at your challenges, what you presented me today. You presented us. It said challenges, there will be delays. So I think it should be just, you hand me a spreadsheet. I don't have time to call you every time somebody brings something. I should know, they should know. And all I gotta do, our chief of staff, is go to a little spreadsheet. I'm not going on no website to look for it. I'm not gonna try to track you down. If you know you got delays, you know this because you're dealing with the people. Hey, we said we was gonna do it this time, we ain't gonna make this year, or we don't anticipate making. Now, I'm not saying every second, if it's a week, 7 days, 30 days, but I'm talking about if you know something, you deal with this every day. Give us the new spreadsheet. What are the new dates? Do you have some delays? Are there, each project, it's a new date on this one, it's a new date on that one. And then our chief of staff, they could just, somebody call, they could just look at it. But we'd only get 2 staff members. Y'all got a full staff down there with making a lot more money than our people. And so I just think with this PowerPoint, after this PowerPoint, we should get an email sometime in the next week that says, here's 120 projects, here's where they are, here's the date we anticipated, due to delays, here's the new anticipated date. And it kind of gives us a mental understanding. And if someone does call, they just go right to the little list. And that cuts down the time.
It's certainly something we can, every project has a schedule. Every schedule gets updated every month. Every month, we produce a suite of reports, including a schedule variance, so that information is available. We do share it with the monitor team as well, so.
Yes, I believe that report is provided monthly to the county monitor team.
Okay.
So of all the projects and what stage they're at.
Thank you. Commissioner Dreehouse.
Thank you, Madam President. Thank you for being here this afternoon. So I, too, want to focus a little bit on the delay aspect, of not so much of the new projects, although I think that's important, but also the asset management piece, as we struggle to keep up with the asset management and the timeframes. So if there is a delay being caused by personnel issues, and I know we budgeted, I think, at the amount that was requested in the last CIP, so we were all in agreement as to trying to, keep the personnel in place so that we can move these projects as quickly as possible. But if there are delays now being created because of personnel issues, I guess before we vote on the next CIP, could you provide us with a strategy to think through how we continue to move these projects if possible, especially the asset management, with a reduction in personnel, and then how quickly you think that scenario might change by way of your hiring processes? I don't know which positions are vacant at the moment, but I think it might be helpful as we move into this next budget cycle to better understand what that strategy looks like, because we will be then allocating not only personnel dollars, but the capital dollars. And so I think we try to be as supportive as possible to move stuff forward as quickly as we can. So I will hope that we have that information as we start to make these decisions in the next cycle.
Yes, I think we're planning on providing an update on that as part of our budget report. In particular, from a hiring standpoint, I think, a lot of these vacancies occurred last year. The city had the early retirement incentive program. We also just had a number of people that were at their time to retire in any event, and then just other departures that are unexpected. But we have been, we're now in September. We have been working very, very hard. Our HR team has been working very hard to fill these vacancies, and just in the last month or two in particular, we brought in 4 or 5 people onto our engineering team. So, we're bringing them in. We've had a lot of, efforts and ways that we've tried to, to get the positions filled as quickly as possible, but it's taken a while. So I think now we're in a much better position than we were. I will say, though, as part of this personnel budget, we did budget for a large variance, meaning we knew we had a lot of vacancies and we would not have all the positions filled for, the full year. So it was kind of somewhat factored into our budget as we went into this year. So that, now that we're at the end of the year, as we're filling those, we're kind of back to where we should be. So
How many, did you say how many positions are vacant?
at the beginning of the year, we had, at one point, I think we had 50 or 60, not in engineering, but overall at MSD.
Of the
Funded
total being
vacancies, yeah, of
600
the
or so?
positions, right.
Okay, so 50 of 600 or so, is that right?
Yes, exactly.
Okay.
So we were well below 600. for a period of time, and we've been slowly, actually, we've ramped up. It was like there was nothing happening in the beginning of the year, and now we've really been hiring a lot over the last several months, so.
Thank you.
Okay.
Thank you.
I'll just, I guess, a
Yes.
reassurance, even with the reduction on some of the internal resources, and, you know, even looking from like a market capacity standpoint, there are not projects that have been just put on hold,
Right.
you know, because we don't have a resource. This is a lot about doing more with less. You know, we're using systems and technology to kind of leverage the efficiency so people can do a little bit more. And I don't believe from like a contractor standpoint, we're not at a point where they're going, we've got all we can do, we can't do any more, and stuff is starting to stall. There is an appetite for doing more work out there if we can get the work to them. So everybody is still moving through. There are no projects that are just sitting on the back burner. Everything is moving forward.
And I think we understand that. I didn't hear you say hold, that anything was being held, but there were some delays, so. Commissioner Dreehouse?
Yeah, just one last question. I think you touched on this earlier. So as you think about that moving into the end of the year, did you say that you anticipate, or is it current, that 80% of the budgeted projects were going to be completed by the end of the year? Did I hear you say that?
I think what it says from a cash flow perspective, what we forecasted we would actually spend in dollars in 2021, we'll actually spend about 80% of that which was forecasted.
Okay. So does that
So
translate?
it's about where you've been over the past probably 10 years.
I was going to ask you for the trajectory of that. So is that standard?
It has been,
Yeah.
Okay. Okay, thank you.
Madam President?
So as you spend the 80%, then you also have a percentage of projects that were completed, correct? Okay, we'll get that. Okay, yes.
Just a quick question, in terms of anticipating where we're going towards the end of the year, I think Diana and Todd in the presentation had said we had, the board legislated 18 construction projects, or the CIP contained 18 construction projects, correct? I don't think they've legislated a whole lot to this point in the year. I don't know the exact count, but looking at your slide, it looks like you've got several being advertised and more looking to be advertised for the end of the year. So in terms of the board, just expectations through the end of the year, should we be expecting a significant number of construction approvals towards the end of the year, or might some of these bleed into 2022?
No, there's a pretty heavy load expected in Q4.
Okay.
Yeah,
Right,
that's
and-
all.
There are some that have moved into 2022, unfortunately, but there's a bunch coming through in Q4.
Okay, and do you know the split, on the 18, do you know the split between WIP and asset management?
I don't.
Okay. If, I just wondering if you have the number. Yeah, I didn't see it in the other slide, Diana. But, okay, I just,
Project list.
okay, all right, thank you.
Thank you.
Madam President?
Yes,
Can I just ask one thing, just for me, for clarification? That 80%, that's 80% spent or 80% encumbered? Okay, thank you. That helps.
Thank you.
Thank you. We'll move forward. Item 4 is no longer on our agenda. We'll go to item 5. It's a resolution appointing 3 members to the Board of Hamilton County Mental Health and Recovery Board. Tom Gableman, Ashley Young, and Mary Ellen Malas. You have a resolution in front of you. Are there any questions or comments as it relates to that board specifically, or the appointments? Okay. Hearing none, I'd like to make a motion to adopt the resolution appointing 3 members to the Board of Hamilton County Mental Health and Recovery Board.
Second,
Commissioner Summer Dumas?
Yes,
Commissioner Reese?
yes.
Commissioner Dreehouse?
Yes.
thank you. Okay, we have in front of us 2 executive sessions. I will read. Our first executive session pursuant, I'd like to make a motion to go to executive session pursuant to ORC Section 121.22 G2 to consider the purchase of property. And the second executive session is pursuant to RC Section 21.22 G1 to consider the appointment, employment, promotion, or compensation of a public employee or official.
Second,
Commissioner Summer Dumas?
Yes,
Commissioner Reese?
yes.
Commissioner Dreehouse?
thank you.
I'm going to need to sign.